She was just a quiet hospital cleaner. For 18 years, she worked at the same St. Mary's Hospital, cleaning corridors, collecting trash, politely greeting doctors and nurses, and no one ever questioned who she really was. Until that horrific bus accident happened. 23 injured, 6 in critical condition, the emergency room overflowing, doctors overwhelmed. But when that old cleaning lady saw the bloody stretchers, she began doing something that left the entire hospital stunned. Welcome to Hidden Hero Stories. Before we begin this powerful story, tell us in the comments which city you're watching from today. And if you believe stories like this need to be told, hit that subscribe button to support our channel. St. Mary's General Hospital was a mid-sized 400-bed hospital in the south side of Chicago. Founded in the 1960s, expanded over the years, it was one of the city's most trusted healthcare institutions. With its emergency department, surgical wing, and intensive care unit, it served thousands of patients daily. Margaret Thompson, whom everyone at the hospital called Maggie, was a 63-year-old cleaning staff member. Medium height, gray hair, always wearing her blue cleaning uniform. She'd worked at this hospital for 18 years. She came in every morning at 6, left at 6 p.m. She was reliable, quiet, careful. Hospital staff loved Maggie. She was respectful to doctors, helpful to nurses. Seeing patients saddened her, but she never complained, just did her job quietly. When cleaning patient rooms, she was very careful and spoke kindly to patients. "Good morning, honey. How are you feeling today?" she'd say to patients. Her voice was soft, genuine. Patients loved her because Maggie didn't just clean the room, she cared about them. But Maggie had some peculiar habits. For instance, when cleaning patient rooms, she'd look at patients' vital signs, read the monitors. Most cleaning staff wouldn't pay attention to these things, but Maggie was different. As if she understood these numbers. Young Dr. Sarah Chen had once asked, "Maggie, why do you read the monitors? Do you understand these numbers?" Maggie had smiled. "A little, sweetheart. I watch medical shows on TV. I'm curious about how patients are doing." Technically true, but the reality was much more complex. Maggie's day started the same way every morning. She'd wake up at 5:30, make coffee, listen to local medical news. But her medical news listening was unusual. She closely followed new treatment methods, surgical techniques, drug developments. When she arrived at the hospital at 6 a.m., her first task was learning what happened overnight. She'd have brief conversations with night shift personnel, curious about how many patients came in, what cases occurred. "Busy night?" she'd ask nurses. 3 trauma cases, 2 cardiac arrests," they'd say. Maggie would take note, as if she was maintaining her own database. When doing cleaning work, Maggie was very systematic. First, the most critical areas: ICU, ER, surgery floors, then general wards. Everything according to priority order. This wasn't normal cleaning routine. This was medical priority routine. Dr. Richard Martinez, the chief of surgery, had noticed Maggie. "This woman is different," he had said one day. "She organizes her cleaning work according to medical urgency." In Maggie's small storage room in the basement were strange things: medical textbooks, anatomy atlases, surgical instruments. Maggie said these were hobbies. "Medicine is an interesting field," she'd say. "I love learning." But these books weren't undergraduate level. They were advanced surgery textbooks. And the surgical instruments were real, sterilized, professional grade. Also, Maggie's behavior in patient rooms was very careful. When she noticed abnormalities in patient vital signs, she'd immediately alert nurses. "Nurse Rodriguez, the patient in room 314's oxygen level looks low." Linda Rodriguez would check. Maggie was always right. "Maggie, you make very good observations about these things. Did you ever think about becoming a nurse?" Maggie would hesitate. "Once upon a time, a very long time ago." St. Mary's Hospital had a very strict hierarchy. At the top were attending physicians, then residents, interns, nurses, technicians, and at the bottom support staff, cleaning personnel. Maggie was at the bottom, but everyone who talked to her felt she was different. She knew medical terminology, understood procedures, showed expertise in patient care. Dr. Sarah Chen, 29, was a fresh resident, very stressed during surgery rotation, very tired. Maggie showed her special attention, would bring her coffee. "Dr. Chen, you look very tired. You need to take a break." "Maggie, I've been working for 16 hours. I can't take a break." "Honey, you'll burn out. I've experienced this too. You need to take care of yourself. Sarah would be surprised. You experienced this too? Where? Long story, sweetheart, but what's important is your health. Maggie's relationship with Chief of Surgery Dr. Martinez was also interesting. Martinez was very experienced, an old-school surgeon. Maggie would follow his operations from a distance, of course, but she was curious. Maggie, why are you so interested in surgery? Martinez had asked one day. It's a very impressive field, doctor. You save people. Have you ever worked in the medical field? Maggie had stopped. A little. A very long time ago. Sunday afternoon, April 15th, was a normal day at St. Mary's Hospital. Weekend shift, minimal staff, routine cases. Maggie was cleaning the emergency department. Dr. Chen was resting in the break room. At 2:30 p.m., an announcement came over the hospital PA system. Mass casualty event incoming. All available staff to ER immediately. This is not a drill. Maggie looked up. Mass casualty. This meant serious. A few minutes later, ambulance sirens started. The first ambulance arrived, followed by the second, third. Then, fire trucks, police cars. Chaos began at the ER entrance, paramedics shouting, stretchers coming, blood everywhere. Bus accident on I-94, shouted a paramedic. 23 casualties, 6 critical. Maggie left her cleaning cart, ran to the ER. She'd worked at the hospital for 18 years, but had never seen such a scene. Dr. Martinez came running. How many trauma bays do we have? 4 available, said Nurse Rodriguez. 4 bays, 6 critical patients. Math doesn't work. Meanwhile, the injured began arriving. On the first stretcher, a woman about 30 years old. Head trauma, unconscious, blood everywhere. Second stretcher, teenage boy, leg fracture, screaming in pain. Third, elderly man, chest trauma, difficulty breathing. Fourth, fifth, sixth, the ER was overflowing. Not enough doctors, nurses overwhelmed, equipment limited. Maggie stood in a corner, watching. But she wasn't just watching. She was analyzing. Maggie assessed the critical situation. 6 critical patients, 4 trauma bays. 2 patients would wait in the corridor, but they could die. Dr. Chen was trying to do triage, but was overwhelmed. She was confusing priorities, wasting time. Priority 1, head trauma woman, Chen said. Maggie approached. Dr. Chen, excuse me. Maggie, not now. I'm busy. Doctor, that woman is stable. Breathing normal, pulse strong. The critical one is the elderly man. He's showing pneumothorax symptoms. Sarah was surprised. How do you understand these things? Chest movement is asymmetric. There's jugular vein distension. He needs immediate needle decompression. Dr. Chen looked at Maggie. How did she know this terminology? Meanwhile, the elderly man's condition was worsening. His skin color was turning blue, breathing difficult. Dr. Chen, shouted Nurse Rodriguez, Mr. Johnson is deteriorating. Sarah panicked. She didn't know how to treat pneumothorax. She was still a resident, didn't have enough experience. Maggie made a decision. This man was going to die. Dr. Chen, step aside. Maggie, what are you doing? Maggie took a needle from the medical cart. 14 gauge, large bore. Perfect for pneumothorax decompression. Maggie, what are you doing? You're a cleaning lady. Maggie approached the elderly man. She palpated his chest, found the correct insertion point, second intercostal space, mid-clavicular line. She inserted the needle. Immediately, there was a hissing sound. Trapped air was escaping. Mr. Johnson's breathing improved. His skin color returned to normal. The entire ER froze. The cleaning lady had performed a life-saving medical procedure. Dr. Martinez came running. What the hell happened here? Maggie just saved Mr. Johnson's life, said Dr. Chen in amazement. Dr. Martinez looked at Maggie. You performed pneumothorax decompression? How do you know this? Maggie washed her hands, stayed calm. Because I used to do this job. For a long time. What do you mean? I'm a doctor. I was a trauma surgeon. The entire ER fell silent. Everyone looked at Maggie. Dr. Martinez approached. You're a physician? Which medical school? Johns Hopkins, class of 1985, surgery residency at Mass General, 10 years trauma surgery, 15 years Army field medicine. Sarah's mouth fell open. You were an Army surgeon? Started as a field medic, then became a physician. From Vietnam to Afghanistan. Dr. Martinez had a realization. You're Dr. Margaret Thompson? The Margaret Thompson? Former, Maggie said quietly. Oh my God, you're a legend. There are case studies of yours in medical literature, battlefield trauma innovations. The entire ER staff surrounded Maggie. This woman was a legend, but had been working among them as a cleaning lady for 18 years. Maggie, said Dr. Chen, why didn't you ever say anything? Because that life is over. I just wanted to be Maggie. Meanwhile, more critical patients arrived. There was no time for discussion. Dr. Thompson, said Dr. Martinez formally, will you assist us? Maggie hesitated. She hadn't practiced medicine for 18 years. But Mr. Johnson looked at her. Thank you, doctor. You saved my life. She'd made her decision. I'll help. Maggie brought her medical kit from the storage room. Surgical instruments, reference books, emergency supplies she'd kept for 18 years. We'll do triage, said Maggie, taking command. Priority system, immediate, delayed, minimal, expectant. Dr. Martinez nodded. You lead. Maggie started a systematic approach. She identified critical cases, immediate priority, head trauma woman, possible intracranial bleeding, teenage boy, compound fracture with vascular compromise, middle-aged man, internal bleeding suspected delayed priority, minor fractures, lacerations, stable but requiring surgery. She turned to Dr. Chen. Sarah, take the head trauma case, order a CT scan, neurosurgery consult. To Dr. Martinez. Richard, the internal bleeding case is yours. Prepare the OR. She headed to the teenage boy. This leg fracture is complicated. There's vascular injury. Maggie examined the boy's leg. No pulse, poor skin color, arterial damage. Needs immediate surgery, vascular repair. Maggie, said Dr. Martinez, can you operate? Maggie stopped. It had been 18 years. I don't know, but I can try. In the operating room, Maggie scrubbed in. For the first time in 18 years. Her hands weren't trembling. Muscle memory was there. Dr. Chen assisted. Nurse Rodriguez prepared instruments. Ready, Dr. Thompson? Ready. She made the incision. Clean, precise. Her old skills were returning. She located the arterial damage. Torn femoral artery. Without repair, the boy could lose his leg. Vascular clamp, said Maggie. She isolated the artery, assessed the damage. We'll do an end-to-end anastomosis, she said, explaining to Dr. Chen. She began suturing. 6-0 proline, microsuturing. Perfect technique. Dr. Chen watched in amazement. You're suturing. It's like art. Practice, said Maggie. Thousands of operations. 30 minutes later, the repair was complete. Blood flow was restored. The pulse returned. Done, said Maggie. Dr. Chen wanted to applaud, but it was inappropriate in the OR. Dr. Thompson, that was incredible. Maggie removed her gloves. This boy will keep his leg, that's what matters. After the operation, hospital administrator James Wilson met with Maggie. Dr. Thompson, I need to understand this situation. You've been working here as custodial staff for 18 years, but you're actually a physician. Yes, sir. Do you have a current license? Number it expired in 2005. I didn't renew it. Why not? Maggie looked out the window. Burnout. Too many deaths. I was exhausted. But you did amazing work today. You saved lives. This was different. There was immediate need, Wilson thought. Maggie, we want to offer you a consulting position, medical advisor. Number, I'm a cleaning lady. This is my choice. But you're wasting your talent. Talent isn't wasted. When I clean patient rooms, I'm caring for them. That's also medicine. The next day, the entire hospital knew Maggie's story. They were whispering, legend among us. Dr. Sarah Chen approached Maggie. Maggie, would you teach me? You're an incredible surgeon. Sarah, I'm already teaching you. Caring, compassion, humility. These are more important than technical skills. Dr. Martinez came. Maggie, I want to write a case study for a medical journal. I want to document your innovations. Richard, it's not innovation. It's basic medicine. The problem is, modern medicine focuses on technology, forgets the human touch. Nurse Rodriguez. Maggie, you're inspiring. Don't you want to share your experiences? Linda, I'm already sharing. Every day with every patient. Mr. Johnson, the elderly man who recovered from pneumothorax, visited Maggie. Dr. Thompson, you saved my life. How can I thank you? Mr. Johnson, stay healthy. Spend time with your family. That's thanks enough. The teenage boy who had leg surgery came with crutches. Maggie, the doctor said I could have lost my leg. You saved it. Honey, you're young. You're strong. You did your own healing. I just helped. Patients looked at Maggie differently. She wasn't just a cleaning lady anymore. She was a healing angel. A week later, a call came from the Illinois Medical Board. Director Dr. Patricia Williams. Dr. Thompson, we heard about your case. Would you consider license reactivation? Dr. Williams, I'm not interested. I'm happy with my current job. But you could serve the community, free clinic, volunteer work, Maggie thought. I could consider part-time volunteering, but no full-time practice. That's acceptable. Would you consult on trauma cases? In emergency situations? Yes. Dr. Martinez had a private conversation with Maggie. Maggie, why did you really retire? You were a surgeon at your peak. Maggie sipped coffee. Richard, for 25 years I worked with death. In war zones, trauma centers. The emotional toll was too heavy. But you were saving lives. Yes, but I couldn't save some lives. Every lost patient cost me a piece of my soul. So you sought peace? Exactly. Cleaning, caring, simple life. This gave me peace. But today you did something amazing. Today was different. There was immediate need. I had to use my expertise. And don't you miss surgery? Maggie thought. Sometimes, but I learned that healing doesn't just happen through surgery. It happens through compassion, caring, human touch. A month later, Maggie still worked at the same hospital, doing the same cleaning duties. But now everyone knew she wasn't just a custodian, she was a healer. Sarah Chen had asked her, Maggie, do you regret it? Having stayed hidden? Maggie had smiled. Sarah, I wasn't hidden. I was always healing. Just in a different way. What do you mean? When I cleaned patient rooms, I talked to them. I gave comfort. I calmed their fears. That's also medicine. Dr. Martinez approached. Maggie, you're an inspiration to all of us, an example of both humility and excellence. Maggie surveyed the corridors. Richard, medicine isn't just technical skill. It's heart, compassion, human connection. Technology can't replace these things. Maggie still works at the same St. Mary's Hospital. She still wears the same blue uniform, does the same cleaning duties. But now everyone knows that sometimes the greatest healers serve in the humblest places. And maybe today, you passed by a healer without noticing. Tell us in the comments, have you ever encountered such a hidden healer? Someone you thought was ordinary but then learned their true identity? Don't forget to subscribe to Hidden Hero Stories. We share powerful stories like this every week. We'll see you in the next story. Until then, take another look at the ordinary-looking people around you. Maybe they're healing you in ways you never knew.